Hello, can you tell me what brings you in here?
I've been having a lot of difficulty breathing and just coughing up this nasty pink stuff, and just feeling really weak whenever I'm doing things.
Okay, we'll get you sent back for some diagnostic testing. We want to do an echocardiogram on you, and that's going to determine your ejection fraction along with evaluating your ventricle function. Normal ejection fraction is 55 to 65, and then we also want to check your BNP, which is normally below 100, and that is typically elevated with heart failure. Okay, so your test did reveal that you do have left-sided heart failure. I just want to go ahead and establish with you regular blood flow through the heart. So blood enters the heart through the superior and inferior vena cava, goes to the right atrium, tricuspid valve, the pulmonary artery, pulmonary veins, into the left atrium, the mitral valve, the left ventricle, the aortic valve, and into the aorta, and then out to the rest of the body. So when you have left-sided heart failure, that blood backs up and it increases the pressure in the vessels. So it's backing up into the lungs, and that excess pressure can cause the alveoli of the lungs to burst open, and that's why you get that blood-tinged sputum. Now coming over here, important aspect to know of how the heart functions is preload and afterload. Preload is the volume of blood in ventricles at the end of diastole, and then afterload is the resistance left that the ventricle must overcome to circulate that blood. So when your heart function is impaired, these processes are not able to function at their best. Some more signs and symptoms of left-sided heart failure. We have tachycardia. You're going to, of course, have that exertional dyspnea, so difficulty breathing on exertion. You have that fatigue. You're going to have that bluing of your extremities, like that circummoral cyanosis. You could be confused, restlessness. When listening to your patient, they can have crackles, wheezing, that blood-tinged sputum, cough, and difficulty breathing at night. Okay, we are going to send you home on some cardiac meds. There's 5 main cardiac meds, and those include beta blockers, ACE, ARBs, the calcium channel blockers, diuretics, and these will just help your weakened heart. They all have different processes, and the doctor will determine which one is best suited for you at the moment. As far as management for when you go home, I want you to do daily weights and check your vitals daily. I want you to try to avoid salt if possible. And I'm going to go ahead and hand you over some resources that you can use if you have more questions. Do you have any questions for me?
Now, does that mean I'm gonna have to quit smoking? Cause I smoke at least 2 packs a day. I can't give that up now.
That's a good question, actually. With heart failure, we don't recommend that you smoke. Smoking causes that vasoconstriction, and that's going to make it even harder for your body to get oxygenated blood to your tissues and organs. I know, unfortunate. I know kicking a nicotine addiction obviously isn't the easiest, so just try to gradually decrease your nicotine intake, if you would. Now here's these resources I was talking about. I'll send you home with those. If you have any questions, feel free to just give us a call, okay?
Okay, thank you, ma'am.
All right.